Dr. Rani Bora, thank you for joining us. In psychiatry, often working with complexity, uncertainty, and distress, what helps a person feel safe and understood in that kind of conversation?
I would say when people feel listened to, and people are really good at sensing our energy. Sometimes we might nod our head, but we might be listening to our next thought, or I'm going to ask that question. So when people get a sense that we are slowing down and really trying to do our best to listen beyond our years, to listening from the heart, and genuinely saying that this is the person, this is their life, this is their perception, and not making it wrong. And that's when I think people feel safe. And we might not agree with everything people say, but it's genuinely listening as best as we can, not to say back, say the next question or answer the next
Of
question.
course, yeah.
And I think that really helps people to see that, okay, there's something in the energy. I would say presence. I would say that in the presence, the being in the now for ourselves, it allows the people to think, okay, this person is cares, and this person is listening to me, and I also feel heard.
And one of the themes running through this conference that we're attending today, the Sustainable Healer, is about relational care. Um, what difference do you think that makes to people?
I think that's a huge makes a huge difference. So if people feel that, oh, this practitioner can relate to my pain, my suffering, that we are human beings. Okay, they might be a psychiatrist, they might be a healthcare professional, but they can relate to me. I think that makes a huge difference. And I would say, think about like being in the shoes of the other person. When we, like as a practitioner, when we say, would I be experiencing something similar if I were in their shoes, really brings us to like, okay, we forget our roles, we forget our identities, like, oh, I need to come up with an answer for this person, to really relating at a human to human level. And so then also we get quiet, our listening also gets better. And again, it goes back to the first question you asked, like people feel heard, people feel seen. And that is so different to like, oh, I'm going to fix you and I have the answers, to let's collaborate on the care and see how we can map out the journey together.
What helps clinicians feel confident enough to slow down, to listen well, as you've said, and respond in a more human way, even when systems are really under pressure, under stress?
I would say two things here. When the practitioner knows that there is no them and us, okay, so we are all in this together. It's a part of human experiences. We have all kinds of emotions, and so I don't necessarily have to come up with an answer for this person right now. And that really helps the person, the practitioner, slow down. But the other thing I would say is genuinely really understanding that everyone has got innate resilience. And this is something I spoke at the conference. So when the clinician realizes that they are not broken themselves, and the patient also can never be broken because there's no them and us, and we all have an innate resilience to bounce back. We take the pressure off us to try to fix people, because we know that, okay, they can't see it right now, they're a bit lost, and all I'm doing here is I'm sitting with them so that they start to see that, oh, I can come up with my answer myself. So the doctor, the practitioner, is more like a coach, not saying that I have got your answer, but bringing out the answer in the person and supporting them with that, with their listening, with this just the relational work, I think. And so to wrap it all up, I would say really knowing that the person already has the answer they're looking for at some level, at the core of who they are. Let me say that again. At the core of who they are, they can never be broken, and they always have access to what I call wisdom. And when the clinician knows that, they're like, okay, I don't have to come up with an answer.